Hello there. Thank you for tuning in to Town Meeting TV's coverage of the 2024 election. My name's Bobby Lussier. This program is a series of forums that we are providing you in advance of the general election on November 5th to introduce you to the candidates on your ballot and the questions that you'll see on your ballot this year. You can find all of our forums on cctv.org/general. You can also find them on our YouTube channel where auto-generated captions are available. And if you're tuning in on YouTube, we invite you to click that subscribe button and stay tuned into local democracy for this election season. Tonight's program will hear for the two candidates running unopposed for the Chittenden, 22. Chittenden 22 House District. They are Karen Dolan and Houghton. Thank you both so much for joining us tonight.
Thank you.
So we've prepared a list of questions that you've both received, and you'll have 90 seconds to answer each question. And if you're tuning in live, we also welcome your questions at 802-862-3966. If you call in, we will do our best to prioritize your question, though we will screen calls to ensure that questions are not repeated. And we ask that you share your name, where you're calling from, and that your question is directed at both of the candidates here tonight. So, and you can also, we remind you that you can submit questions for future forums online at cctv.org/general. Okay, so let's get started with 1 minute opening statements, and we'll start with you, Karen Dolan, your opening statement for the Vermont House District here.
Great, thank you. I really thank you for this opportunity to connect with voters. I feel like it's a really important piece and appreciate it.
Yeah.
And so, I'm extremely grateful to be on the ballot again for Essex Junction. This is going to be, I'm running for my third term and really continue to appreciate this opportunity to provide service to the community. And I feel like the legislature has really made important progress in the past 2 terms that I've served. And in particular, I'm really proud of our work in expanding access to childcare, our investment in affordable housing. We have really done work in strengthening our firearm laws and expanding restorative justice practices throughout the state, which is something that is very dear to me. So as a representative for Essex Junction, I really remain steadfast in my commitment to the values that I set out at the beginning of curiosity, communication, and collaboration. And I continue to believe that those values are serving the community well. And I want to stick with them during the coming session when we're going to tackle a whole new array of challenges from education finance, healthcare infrastructure, and ensuring that our state's safety net of service both remains effective and sustainable for us.
Thank you so much, Karen. Houghton, your opening statement.
Great, thank you, Bobby. I echo Karen's thanks for having us. It's important to be able to talk to voters both at the doors and through venues like this. And thank you for CCTV for doing this. I'm humbled by the continued support of the Essex Junction residents. I'm in serving my 4th term. I've always served in the House Healthcare Committee, and this past biennium I was selected to be chair of that committee. I ran 8 years ago because I spent some time in the State House, and I realized there were very few, if any, legislators that had children in the school system. At the time, I had a 2nd grader, and I thought it was really important to ensure that his voice and the voice of other young children could be heard, because the bills we're passing now will affect them as they grow. I'm running again because we need experienced leaders who will look at the data, listen to experts, and make the hard political decisions that we need to make to ensure that our state can move forward and that all people can thrive here. And we have a lot of work to do ahead of us. Karen mentioned some of the issues at hand. You know, for me, it's healthcare and education come to the top of the list, where we really need to reimagine our systems that we have here in Vermont. So I am engaged in that work, and I look forward to hopefully making it back to the State House to continue that work.
Great, awesome. Thank you both again so much for being here. I didn't mention at the top of the show that today is Town Meeting TV's 34th birthday. 34 years ago today, this Channel 17 kicked off and started covering these communities, including Essex Junction. So
that's great.
Picked no better day to be here.
Right.
Looking forward to the cake that's going to be coming out, right?
Exactly.
We'll see if we can get that for you. So first question here is a question that's on many voters' minds. We'll talk about property taxes and education. This year, many Vermonters will are seeing a double-digit increase in their property taxes. Nearly a third of school budgets failed on town meeting day. How will you approach education funding reform and property taxes for the coming fiscal year? And we'll start with you, Representative
Great,
Houghton.
thanks. It's clear that we need systematic changes in our education system. We need to ensure that we have a high quality education system that our taxpayers can afford. And so we took steps this past year to help mitigate the increase and to help schools make some different decisions. And so one of the things we did was a BOCES bill that allows collaboration amongst supervisory unions and districts to share resources and employees. And so we hope that will...
Can you clarify what a BOCE is?
I wish I could tell you exactly what the abbreviation
I'm not going to remember the acronym either.
But I'll give you an example. So let's say you have a French teacher in Essex Westford School District working part-time. Right now, they could not also work at Champlain Valley Union. This would allow some collaboration to get past all the rules in order for that person to work at both places. And so hopefully it will increase access for children, but also bring down costs. And we also put in place a school construction bill and to look at our buildings. We have a lot of buildings, so we put that in place. And then we did put about $69 million in to buy down the property taxes, but we can't keep doing that going forward. So we have some really hard decisions ahead of us, not only on how to finance, but what the structure looks like. Things like number of supervisory unions, do we have mandate size classes, do we close some schools, do we do local versus state decision making? So really, really hard decisions. We have a commission that will be bringing preliminary short-term solutions or recommendations to us in December, and we'll take a look at those, and then we have a final report due the following December. So we'll be looking at that data and making some hard decisions. I will say the one thing about Karen and I, we work closely with our school board, our school finance folks, and constituents, and so we will bring all voices to the table in Montpelier.
Great, thank you so much. Karen Dolan.
Yes, so happy to echo everything that Lori just shared, and I think the last thing that she mentioned, that we work in collaboration together with our school board and our community leaders, and just echoes how we're on board with this. We know that this is a situation. In the past few weeks, we've been knocking on doors, and this is a top priority, what we're hearing of folks. And there's also, I think, getting to be a greater understanding of the issue, of that it's just not a matter of making cuts across the board or raising taxes. We need a combination of solutions, and that it really takes that balance between looking at the local control piece of it and what we can do at the state level. And so having these conversations and knocking on doors, I feel like has helped to set the stage for these hard discussions that Lori just shared that are going to be coming up. And I feel like we are ready. We're in a place coming next biennium, especially with these reports coming out. They're going to help give us some concrete recommendations. That, together with the community being ready for some change, we're going to be able to put those pieces together. So looking forward to what's ahead, and again, agreeing that the current situation is not sustainable.
Great, thank you. Yeah, that issue has been the top issue, it sounds like, from everyone that we've had in the studio thus far. So let's now move on to another issue that seems to be on top of mind for many voters, that's housing. This past session, Democrats in the House, including I think both of you, proposed spending an additional $100 million per year for 10 years on publicly subsidized affordable housing, but this level of investment was not passed in the Senate. So the question here, would you support this level of public investment in housing again? And is that the way to move forward here? And we'll start with you, Representative Dolan.
Yes, absolutely. I know it's hard going the same thing of talking about property tax increases, and so saying another investment, but the reality is that housing is at that foundational level of we need to have everybody housed, and we need to have it in order to sustain the rest of the state. So a significant investment in housing is essential in order to really lift up all Vermonters across the state. And it's not only a basic need, but it is essential in order to have a robust economy and fuel our state. So housing fuels our workforce, our communities, our ability to provide services to everyone, and ultimately it impacts the age and growth of our population. So I think in short, this big investment in housing is essential for the future of Vermont. I also was connected to a study where access to affordable housing is showing that it's connected to homelessness. This is a recent report from Department of Housing and Community Development, cited a need for 24,000 to 39,000 more housing units by 2029, specifically noting that a lack of affordable housing is one of the contributing factors to the increase in homelessness, which I think we're all hearing in the media right now is a tragic crisis that we're in that's going to be coming up, or already is. So I think with this, Vermonters are on board that we need to make this investment. It's a matter of figuring out how are we going to do that. And I will say the thing that we're fortunate about in Vermont, we have a lot of organizations that are focused on the issue of housing. And we actually have reports and recommendations for them. They have mapped out a plan. What they need is the funding to implement that plan. And that's what we need to do. And we're going to see the payoff on that tenfold if we get that investment down. We've gone part way. We just need to finish the work.
Thank you so much.
I will echo everything Karen says. I think you'll hear that a lot from both of us tonight. Yes, the financing is imperative. We did pass Act 181 that modernizes our Act 250 process in a way that is predictable, transparent, and provides a long-range vision. But regulation alone isn't going to fix our problem. We can't regulate, 30,000 homes, as Karen cited the numbers. In every issue that comes into my committee in healthcare, housing is discussed. Doesn't matter what it is. If it's mental health, if it's workforce, if it's substance use, whatever. Housing is one of the number one issues that we hear about. And so housing means people are going to be healthier. Not having housing means people are stressed, and it brings on a whole slew of problems that unfortunately we're having to spend money on rather than to do it up front. So I think the money to go in is imperative, and I truly believe it's a problem that we can fix.
And we'll move on to a similar question here, which is facing the folks who are most struggling to find housing, and this is about emergency shelter. Vermont reported 3,295 people experiencing homelessness in 2023. That's up almost triple from where the number was in 2020. So this year and right now as we speak, the state is rolling back its pandemic-era emergency shelter capacity across the state, which is pushing hundreds more Vermonters onto the streets. How will you approach the need for emergency shelter in the coming session, and how should the state pay for it?
Yeah,
Lori?
I mean, ultimately, the answer is more housing, right? So everyone should have a right to a home, and I firmly believe that, and I think the values of our state support that. We need to get there. So while we have a high number of homelessness, we also had the highest number of sheltered people. And unfortunately, as you mentioned, now the pandemic era money is going away. With that, though, we are still spending tens of millions more in emergency shelters, in helping people, in expanding that capacity, increasing supportive services, and increasing housing for people with substance use and disabilities and other factors. So we are spending more. We are, I think, doing a better job of getting the supports around people that will help them. And we need to continue to do more. H.879 was passed in the House, did not pass the Senate, and that would have created a plan to go forward with the emergency program. Some of that did make it into the budget, and so there's a committee that's working right now that will come back in December, and the House Human Services Committee will act upon those recommendations. And the goal is to put parameters around a permanent program that will be predictable for eligible households, community providers, and the state budget. And again, ultimately, we need more housing.
Thank you, Lori. Karen, your thoughts on this?
Yes. Again, ditto, echo these pieces. Having anybody without a house, without a home is not okay, and we need to address this. But I think it is interesting to just step back and kind of understand how we got to this place where we were at. With the pandemic, we got a flood of federal funds that showed us that, yes, you can do things to make sure that everybody is housed and everybody has a home. And it would be wonderful if we could continue with those things, but the reality is that funding is no longer there. And we're not at a place in time where we have the revenue or tax capacity to do that. Those are things that we can be considering. What can we do? And at the same time, we also have to look at what are the solutions that are sustainable for our community. And I think Lori was sharing some of those with the emergency housing, of really creating this permanent program that it's not just every year we figure out what we need to do, but this is a program that is available. These are the clear criteria, the parameters around it, so that can make it so predictable for folks. So if we know what's there, then it's easier to fill in the gaps around it. And we don't have that system now. We don't have that plan, that leadership. So I'm hoping what we can do is in this coming session, one, figure out the container of funding that we have for certain, and also the program that we have for certain, so then we can fill in those gaps.
Thank you both. A quick follow-up on that question. Are there any shelter beds in Essex Junction currently?
No.
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 Is that something that the community that you think is part of the solution here? Is that, I mean, I live in Burlington. There's a lot of talk in Burlington about how there are many beds in Burlington, and Burlington's shouldering a lot of this
Yes.
challenge. Is there talk in the community, or have you heard from voters about, could there be plans to establish a shelter in Essex Junction?
I haven't heard of any plans or discussion for that, and I think it echoes that piece of we're talking about is the connection to services as well. Is that housing isn't enough on its own. You also need to have all those services and everything in place to make it sustainable. And in Essex, Burlington really is that center where all of the services are. And so, not that I don't think we couldn't consider that, but then I feel like we need to look at all those pieces of how do we get folks to the services that they need. And and just hearing in recent weeks people about the potential for bus lines to be cut in our area. So that is alarming. So I think, yes, I appreciate Burlington shouldering that piece for our county. And I think what we need to do is how do we coordinate to really make sure that folks are getting what they need.
Yeah. Anything to add?
I would just add, I served on the Essex Junction trustees before we became a city, and it would pop up every so often, the ability to do that. I think Karen hit on a key point, and that is transportation, which really underlies everything we're talking about here tonight. If we don't have the transportation to get people where they need to go for the services they need, it's not going to work. And so we need to work on that. And then, yes, I do think it's something that the city should think about.
Thank you both. And let's now jump to a question about healthcare. So one of the primary drivers in rising school budgets and affordability issues in Vermont is the increasing costs of health insurance. And so this question, what can the state do to reduce the cost of healthcare and still meet the healthcare needs of every Vermonter? And I think technically it's Karen's turn to start.
Yes, which I was thinking you were going to turn it to me. And this is the great thing about Lori and I working very close together. I feel like Lori is the chair of healthcare. I sit on judiciary, and in this world of where we have to know so much, we really can lean on each other in those different areas. So not that I don't know anything about healthcare, but I certainly rely on Lori. So I will defer to Lori on this topic.
And I could spend hours on the question, so I appreciate the minute I get from Karen.
Okay, there you go.
Healthcare is really, really expensive, as we all know. And there's a lot driving what's happening in Vermont. I'll focus on two things to lay the groundwork and then tell you a little bit about what we're doing. But one issue is that 47% of Vermonters are insured through either Medicare or Medicaid. Medicare, we can't do anything about. Medicaid, though it's partly funded by state dollars, we have a lot of rules from the federal government. 35% get their health care through employers. It's called an ERISA plan. We can't do anything with that either. So really 82% of our insured population, the legislative policies we make don't really affect that population. I'll come back to that. The other thing to lay the groundwork is we have a system right now where a lot of care is being given in the hospitals, which is our most expensive place to have care given. And our community supports have shrunk. And so we need to change that balance. We need to get people back into the primary care, back into a community health center, and then focus the hospitals on what they do best, and that's high-level care. So some of the things we did in the House Healthcare Committee that passed into legislation, for access, we increased telehealth reimbursements to providers, meaning a primary care provider can have a phone call or a video call with someone that can't make it to the doctor and get paid the same amount, which means they're going to offer it more often. So it's going to help people without transportation, like we talked about, or elderly people who don't want to go out. We joined several interstate compacts to allow more out-of-state providers to serve Vermonters. We passed great legislation that will allow primary care providers to no longer have to do prior authorizations. That will hopefully lessen the burden on them, as well as then increase time for them to see more patients. In regards to cost, we've changed, I'm getting weedy here, but we've changed some claims processing that hopefully will reduce cost at providers, allowing people to be reassigned and be more patient-focused. We also increased eligibility for a program called Medicare Savings, which will help low-income 65-year-old and older people to be able to access healthcare free or at a very substantially reduced cost. And we are licensing pharmacy benefit managers, and I know I'm going too long, and asking the Green Mountain Care Board to come back and regulate a framework for regulating the price of prescription drugs, which is one of the highest drivers. But I think, real quick, the most substantial work we've done is Act 167 of 2022. And that is a look at our hospital sustainability. So there's a report coming out next week that I can't wait to dive into that will provide recommendations on how to reimagine our hospital system. And then we'll do the hard work of seeing what's feasible, what's appropriate, what the hospitals can do, and then how that will change our system into the future. We are the only state doing something like this, and it will really set us out for a 5 to 10 year plan to really try and bring down the cost of healthcare.
Great. Okay, well, thank you for that very robust response in healthcare.
You can see why I lean on.
Yeah, no, sorry, I got a little wonky there, but it's so important to me.
That's why we're here, is to get wonky. So now let's jump to the lightning round. We've got a bunch of just kind of shorter questions, yes or no, or try to stay less than 10 seconds if you can. And the first question here, should private schools be funded with public dollars? And we'll start with you, Lori.
Sure, my answer is no. But they are, and so we need to look at the program, and we need to ensure if it continues that they follow public rules.
Karen?
Yes, I would also say no for that same reason, that for some areas of the state, they rely on private schools, and so we need to address that in order to really fix the issue.
Do you support raising the age of family court jurisdiction? We'll start with you, Karen.
Yes, this is actually coming up as something that I'm going to be co-sponsoring a bill for to do this, because RDAP, which stands for Racial Disparities Advisory Panel, they propose this recommendation as well, and it would be raising the age of delinquency from 10 to 12. So yes, fully support that.
Yes.
Yep. Should biomass, meaning burning wood, the McNeil plant in Burlington being an example, play a role in emissions reduction strategies?
Yes, as long as it's part of a strategy and a multi-pronged strategy at that.
Karen?
Yes.
Yep. Do you support a statewide ban on assault weapons, Karen?
Yes.
Yes.
Okay, quick one there. Did Governor Scott overstep his authority by appointing Zoe Saunders as interim education secretary? Lori?
I think the courts will decide that, but personally it doesn't feel right.
Karen?
I would echo the same, and that's my understanding as well, is that there's a pending lawsuit to officially determine that.
Where do you get your news is the next question. Karen?
I'd say for me it is all the local media outlets really appreciate how robust they are in our state, and so I rely on those heavily in connecting with neighbors and friends as well.
All of that, and I try and listen to BBC, and I read the New York Times.
Thank you both. The next question, do you ride the bus? And this question maybe will take a little bit of extra time because we have had some news recently about bus lines being cut here. So what does the legislature maybe have to do this session to address some of the shortfalls with GMT? And we'll start with you.
So sometimes I ride the bus. I will say, living in Essex Junction, it's easy to walk everywhere, and I work from home when I'm not in the State House. As for what we should do, we need to look at this. As I said before, transportation is underlying all of these issues we're talking about. We're not going to be able to reimagine our healthcare system without having transportation to get people to their doctor's office, right? Housing, we need it for housing, we need it for workforce. So we have looked at it in the past. We will continue to do that. I know there's some reports coming back this year, and I'm looking forward to the transportation committees to helping solve the problem.
Thanks, Lori. Karen?
So I forget what the first question.
Do you ride the
bus? For the same reasons, I don't usually ride the bus. Have I? Yes, but do a lot of walking and biking. And regarding transportation, I say, yeah, it's a key issue for a rural state like Vermont. I do feel like in Chittenden County, we're fortunate. We have a variety of things we can lean on. When one goes away, we can lean on something else, but certainly for other parts of the state, transportation is key. If one piece goes, that's the end of it. So we need to take a look at that.
Great. And the last one's a fun one, although contentious in some places. What's your favorite ice cream in Vermont, Karen?
For me, it really is anything chocolate. But I really feel like I should say maple ice cream, which I went to the fair, I got multiple maple creamies, but definitely chocolate's my favorite.
Nice.
And I unfortunately don't like maple, so I won't say that. And I will have to admit it's Palmer's Creamies in Jericho.
I love their
Yeah,
cream. I always get the maple
So
crunch
sorry,
cream.
Essex Junction folks, but yeah, we go to Palmer's.
Awesome. Okay, and we maybe have time for one more question here. Let's wrap up with a question about the overdose crisis and shift from fun to not so fun.
Yep.
So 231 people died from an overdose in Vermont in 2023, with 95% of those overdoses involving fentanyl. What must be done to prevent overdoses, promote addiction recovery, and deter the illegal sale of opioids in Vermont? And we'll start with you, Lori.
Sure. So, we need to continue the work of focusing on connectedness, decreasing risk factors, and increasing prevention efforts. This includes the work of Act 178, which allows for an overdose prevention center. And I understand that the Department of Health is in public comment right now for the rules they're putting together, or the guidelines they're putting together for that. And are meeting their targets, which is great. We need to continue strengthening our community supports, recovery centers, mental health treatments. We need to really remember that there are co-occurring disorders that we need to focus on at the same time. We can't be having people go one place for one treatment and another place for another. We need to make sure that we have access to prevention through primary care and that we have supports in schools. And back to transportation, we need to make sure people can get to where they need to go in order to get the treatment that they need. One other thing I will add is Vermont just received a waiver through Medicaid that is going to allow us to set up a program that for folks who are incarcerated, they will be able to get Medicaid 90 days before they leave. And the hope is that will allow us to set them up with primary care providers and the treatment providers in the community before they leave prison, and so they have a smooth transition and continue the care that they need.
Thank you, Lori. Karen, your thoughts on the overdose crisis?
Yeah, I think that it's a crisis, and it's really alarming, the amount of fentanyl that's in the system, and we really have to do more. We need to save those lives and the lives that are potentially going to be lost. And I'm really proud to be a part of a legislature that is committed to doing interventions that are based on harm reduction and prevention, because I feel like that is key. And that's from somebody sitting on judiciary. I really am trying to promote, we don't want to go down the criminal path. We need to focus on that prevention and harm reduction. And so taking the time to invest in all of those things that Lori just shared, because that's what's going to prevent us from getting there and to save those lives for folks who are working through addiction, because addiction is a tragic reality in our state. And connecting with folks, just heard from multiple people of how much pain they're going through, how shocked they were, surprised of just how quickly addiction can take over either their life or folks that they know. And we just need to do more to connect folks to the resources that are out there.
Thank you both so much. That is all the time we have for this program. Karen Dolan and Lori Houghton running for Chittenden 22, the Essex Junction House District. Thanks for coming in tonight.
Great. Thank you, Bobby.
Great, and thank you for tuning in to Town Meeting TV's coverage of the 2024 election. You can find this program and many more on cctv.org/general. And don't forget to vote on November 5th. Thanks so much. So long.